need to regulate the provider where the doctor works. So came professional regulation and provider regulation. That means the place where care is provided. So the first bit of my talk would be about regulating the professional. Now this was the professional to be regulated, and I was the medical director of the hospital at that time. Anyway, that was the consultant of 1990, or nearly 2000, around the millennium in 2000. And this is the consultant who had to be controlled. So we had a situation where we had the media asking that doctors need to be controlled because there were the three major issues. The public was against the medical profession, and the government was against the medical profession as well. Unfortunately, at that stage, the professionals, instead of becoming part of the system and helping to move the system and helping to move the patient safety agenda, started working against the system. And which I feel in retrospect was a mistake. Ultimately, the state, i.e. the government, won. And General Medical Council which was a registration body until that point, became a regulatory body. And by law of Parliament, the General Medical Council's overarching objective now was to protect and promote the health, safety and well-being of the public, to promote and maintain public confidence in the profession, to promote and maintain professional standards and conduct for the members of the profession. So it was not only to be a good and a skilled doctor, it was something more. Now in the UK, every doctor is appraised every year, and they are appraised in 4 domains. You've got to be skilled, you've got to be good in your job, you've got to be educated, you've got to get your CMEs and show that you did keep yourself up to date. You've got to put a lot of emphasis on safety and quality, which is the 2nd domain. You've got to be a good communicator, you've got to be a good partner, you've got to be a team player. And most important, about which many doctors fall, is that people need to have trust on you. And I think there's one small subclause in that in your work you have to always act in honesty and integrity. And I think the parallel phrase used in the Pakistan current political scenario is Sadiq and Amin. And the General Medical Council came up with this booklet which is called Good Medical Practice, which is really the Bible of every doctor in the United Kingdom at this time. Currently, the GMC has 4 functions. It looks over medical education, it registers doctors, it appraises every doctor every year and revalidates the license after every 5 years, after ensuring that all the 4 domains of good medical practice have been fulfilled, and it investigates any wrongdoing by any doctor, and anybody can complain against any doctor. Now, on an average, about 8,000 doctors are referred to the General Medical Council in the UK every year. On an average, about 190 to 200 doctors are erased from the register, which means they can't practice if they are found to be guilty. And many of them are suspended, and some get undertakings and some get warnings. And there was a feeling amongst the doctors that they are being over-regulated. And this was until 2018, which was last year, when a Muslim hijabi doctor from Nigeria was on call for 2 days in a pediatric department, which was very busy. She was asked to do the work of 2.5 people because the other colleague of her was away, and a child with Down syndrome was admitted with diarrhea, but he was actually suffering from sepsis, and in the confusion over the weekend the child developed septicemia and died. The doctor was tried for manslaughter, and she was given 2 years 2 years imprisonment, which was suspended. And then the General Medical Council was asked to look at her registration, and the recommendation from the prosecution was that she should be erased. Now, I was on this tribunal, and this was a very tricky case because on this tribunal here was a Muslim doctor with a hijab from Nigeria, that means non-white, and on the panel was myself and another gentleman, a lawyer originally from Bangladesh, and there was a local English social workers. So we three were the tribunal members. After a lot of debate, we decided, and I argued, that she should not be raised, because I thought it wasn't her fault entirely. She should be suspended so that she gets the lesson that a child has died. But because there was a lot of public pressure, we were told that the prosecution was arguing very heavily that she should be raised. To cut the long story short, we did not erase her. We suspended her for 12 months. The GMC immediately went to the High Court, and the High Court overturned our decision. They said she should be raised from the register completely because she has quote unquote killed a Down's child. There was uproar in the UK. All the doctors collected money and took this case to an appeal court. And fortunately, the appeal court agreed with our tribunal decision. And my summary of, I put this case intentionally for you, with you, because I feel that a good doctor fails in a bad system. If you have a bad system, you might be a good and great and skilled doctor. There is always a chance of failure. So let's look at the system and let's look at the provider now quickly. I don't know, many of you may have known this buzzword which came in the medical vocabulary in 1999. It was by Scully and Donaldson, the word called clinical governance. And that meant a framework through which the organizations responsible for care and safeguarding high qualities of standards of care by creating an environment in the hospital by which excellence in clinical care will suffice. At the turn of the millennium, the job of a hospital management committee was that they would get the money and they would spend on patients. So their main aim was finance, management. But from 2000 onwards, finance came number 2. Patient safety and quality of care came number 1. And this was something which was enforced in every organization and every hospital in the United Kingdom. But despite this, in 2006, the chief medical officer said, "Hey guys, it's not working. There is lack of progress. People are still dying of mistakes in medical care. Wrong injections, wrong medication, wrong operations, wrong site surgery, infections, overuse of antibiotics. So we're killing a lot of people. Something is not right still." And then we had this great big scandal in a hospital in Midlands called the Stafford, and many of my colleagues may know about it, which is called the Mid Staffordshire scandal, where over a period of 5 years so many people had died because they had not received proper care in a hospital. Some had died of dehydration, some had died of bleeding because nobody had seen them at the proper time. So it's not only the doctor who is, you may be a wonderful doctor, but if you do not have a system in a hospital where a patient will be looked after, you cannot have a good outcome. So the government said that we must have relentless pressure on patient safety and quality. Must be the top of the agenda for every board, and every management board, and every trust in the country.